Okay, great. I think we can get going. So good afternoon, everybody. Warm welcome to all of you who've joined us today for this Fireside chat. This is part of what we call a Reboot Series by ABC Consultants. So we've had, and I don't know if you heard us chatting a little before this, but we've had lots of interest in this session. And in fact, last I checked, we had 1,050 registrations, which I think given the glut of webinars, I think is quite amazing. And like Ameera was mentioning, maybe healthcare for its change is getting its moment in the sun here, and I suspect it's also got to do with the quality of the panel that we've got today. So I think perhaps for the first time, I think in a century, we are facing not just a health and humanitarian crisis, we're also facing a financial crisis, a demand crisis, a supply crisis, all at the same time. And in many ways, I think the healthcare sector has been in the eye of this storm for the last 100 odd days. And of course, everyone's now become a healthcare expert overnight with a point of view on how things should be managed and what we should be doing. What is interesting is I think when you take this to a granular level, different parts of the healthcare industry have got impacted differently. And in many ways, of course, our true superheroes of this crisis have been frontline healthcare professionals and leaders who I think have gone beyond the call of duty. And I am reminded a lot of, I think, that famous lines from A Tale of Two Cities where, it was the best of times, it was the worst of times, it was the age of wisdom, it was the age of foolishness. We had everything before us and we had nothing before us. So I think fascinating times we live in. And really, I think to understand how the healthcare sector itself is coping and possibly reimagining their future, what does this so-called new normal look like in the context of the healthcare sector? And to try and make sense of some of this, we've got a great panel of top industry leaders across the spectrum of the healthcare sector. So we've got hospitals, devices, diagnostics, and of course, pharmaceuticals here. So looking forward to this, maybe a quick round of introductions of our 6 panelists before we get going. So I'll start with Ameera. Ameera Shah is the Managing Director of Metropolis Healthcare. Metropolis, as I think most of us would know, is a reputed chain of pathology labs across India, delivers 16 million tests annually, rated among the top 1% labs globally for its quality systems and protocols. Ameera is someone who's really spent the last 20 years, I think, building Metropolis brick by brick. They're named amongst Asia's most powerful women in business by Forbes, 50 most powerful women in business by Fortune, well recognized as a global thought leader in the healthcare industry. Welcome, Ameera.
Thank you.
Pavan Mocherla is the Managing Director of Becton Dickinson for India and South Asia operations and has been with BD for 17 odd years. Pavan is a strong believer that innovation can really improve the quality of healthcare in India and believes that it is the only way to improve outcomes for both patients and the efficiency of healthcare services, besides furthering healthcare worker safety. It'll be great to actually hear Pavan's views on that perhaps later in the discussion. Pavan, welcome.
Thank you.
Dr. Ashutosh Raghuvanshi is Managing Director and CEO of Fortis Healthcare. He's a seasoned healthcare professional with over 27 years experience. He's a successful and well-recognized pediatric cardiac surgeon and an able administrator. Before joining Fortis, Dr. Raghuvanshi was Group CEO with the Narayan Hridayalaya Group, where he spent almost 2 decades and helped successfully list it in the Bombay Stock Exchange. Welcome, Dr. Raghuvanshi. Rajaram Narayanan is the Managing Director and Country Chair of Sanofi in India. Sanofi, as most of us know, is one of the world's leading healthcare companies and has been in India for the past 60 years with a vast portfolio of offerings. Rajaram joined Sanofi in 2014 and before that was with Unilever and Bharti Airtel in senior management roles, both in India and the Asian markets. Welcome, Rajaram. Anish Bafna is CEO and Managing Director of the Healthium Group for the past 2 years. Anish has over 25 years of operational and general management experience in the healthcare industry, and a large part of his assignments were actually in managing emerging markets. So he's lived in Vietnam, Indonesia, Malaysia, India, Singapore, and Japan. Proven track record of really building sustainable and profitable businesses before joining Healthium. And he was with Baxter for 12 odd years before that. Welcome, Anish. And finally, Bart Janssens, Managing Director and Senior Partner at the Boston Consulting Group in India. Bart has been with BCG for over 20 years, 16 of which has been in India. Bart specializes in the healthcare sector. He's a co-member of BCG's global healthcare practice. He's advised a broad range of large Indian and multinational life sciences clients, including large pharma, medtech companies, healthcare providers, and emerging health tech startups. Welcome, Bart. And Bart has kindly agreed to moderate our fireside chat today. So without any further delay, Bart, the floor is yours.
Thank you, Shiv. And I must admit that my role today is by far the easiest one. I get to ask the questions, and it's this esteemed panel that has to actually answer them. So what I thought I'll do is I'll spend just a few minutes laying out what's been happening in the healthcare industry and the key issues that the different subsegments of the industry have been facing. And then I'll perhaps set up the discussion structure, and we can dive right in. So just to give you a quick overview of healthcare landscape in India before we dive in. I think Shiv mentioned it already. I think it's important to keep in mind that different subsectors of healthcare have been impacted actually quite differently over the past months. Some saw patient flow pretty much disappear, and others, such as the pharma sector, for example, have seen relatively limited declines. I'll just share a few numbers and trends to get us all anchored. Healthcare spent in India is approximately $120 billion, 8.5 lakh crore. That was last year. About half of that is inpatient care, essentially people that get treated in hospitals or nursing homes. About 45% of that is outpatient care, and that includes any kind of medicines that, for example, we buy in pharmacies. There's about $7 billion that gets spent on labs. Half of that is in path labs, the other half is in radiology labs, and there is about $1 billion in home care solutions. If we look at what has been happening over the last couple of months, it's no surprise patient hospitalizations and patient consultations have dropped considerably during the lockdown, and they're still down double digits. Just to give you a few numbers, in the US, hospitalization cases dropped by 65% during the lockdown. In Indian hospitals, actually, which we surveyed over somewhere, I think mid-May, they reported that there has been an 80% drop in hospitalizations, and that of course excludes any COVID-related emergencies. It's the same story in regular consultations, which happen outside of clinics, what you call OPD. They dropped by 78%. Interestingly, most doctors have reported that they actually started using remote consultation, which was not at all common before the COVID outbreak. So 85% of doctors actually have used it, but they acknowledge at the same time that it's that only represents about 10% of what their normal patient flow would look like if they would operate out of their clinics. Other parts of the healthcare sector have been faring much better. Pharma sector, for example, has seen a negative growth, but it's been relatively moderate. So I think April was down 11%, May was down 9%, and of course chronic therapies have ensured that drop wasn't more pronounced. But enough said for me. Let's hear from our panelists now on their respective companies and how their sectors have been impacted. The way I propose we proceed is that we'll get a quick overview from some panelists on how their respective industry has been impacted, what they have done to manage through this crisis, and then we'll shift towards a discussion on how we can actually start rebooting the healthcare sector again. How do we get patients back in front of doctors and into hospitals, and also understand what changes different companies have made through this crisis in their operating model and what they expect to continue to do or which of those changes will remain in the foreseeable future. Let me start with Dr. Raghuvanshi to get a perspective on what has happened in the hospital sector. Could you briefly describe how your sector has been impacted in the past 3 months, Dr. Raghuvanshi?
Yes, so I think the moment the lockdown was announced, there was a very sharp drop in number of patients coming to the hospital. I think it was because of multiple factors. One of them being just unable to access healthcare because of the lockdown. And then it sort of came down to almost about 10% of what normal occupancies would be. But that gradually started reversing from the month of April itself. And it has gradually now sort of trickled down up to about 50% or so. But in what happened was that only the emergency care was coming to the hospitals. And at the same time, I think there were multiple challenges in terms of human resources, getting our doctors and nurses to be available. That was another very, very major challenge. There were disruptions in our supplies as well, especially, things like which we had outsourced some of the services, like something as simple as laundry or even food services. All those things also were disrupted at the same time. So I think there were multiple things, logistic challenges which were there for the hospitals to even operate at that very little occupancy levels. And of course, there are huge financial consequences of this sudden drop in the business. So this is where it is, but I think it is gradually sort of coming back to some sort of, I wouldn't say normal, but whatever is new. I think one of the biggest challenges for us is to give that confidence to the patient that it is safe to go to the hospital for any other procedures. So this is about the non-COVID work. And that's what we focused on. All the hospitals, private sector hospitals, most of them focus on procedures and tertiary care. So to give that confidence back to patients that it is all right to go to the hospitals is what I think we collectively as an industry have to do. And these things have to be very visible when patients come to the hospital.
Yeah, perhaps a quick follow-up question on specifically that point, Dr. Raghuvanshi. What are some of the, can you perhaps share a few of these changes that you've made at your organization to visibly safeguard the safety and health of patients?
Yeah, so we have created these flu clinics which are outside of the emergency and the routine OPD services, and so that people are screened right there. And then we sort of give them a color-coded thing. If they have any suspicion of exposure, we give them a red band, otherwise we give them a green band. And then the flow in the hospital depends on that band. So whether they go towards red or green zone. So the zones have been separated out. And then once people are suspected to have been exposed in any way, then they go to a flu clinic where they get sort of have a more detailed evaluation. And then if they require any services, they're kept in a separate area till the time it is diagnosed whether they are positive or not. So these flow patterns are very, very sort of visible to people. There are many other changes hospitals have made, like, for example, the visitors policy, many people can visit, etc., has also been changed. And the visitors as well as the staff has to go through the same process of being screened every single day.
Excellent. Ameera, if I may shift to you, with diagnostic testing being so important, over these last couple of months, I imagine that your organization must have gone through a hectic period.
That's right.
Can you describe a bit what has changed in your sector since the start of the COVID outbreak, and how have you been able to, manage a likely sudden surge of volumes?
Sure. I mean, I think before it even hit hospitals, I think it hit diagnostics, right? Because we obviously have to do the diagnosis first and then people get hospitalized. So I think we saw things in sort of late March and early April really heating up. And it was a very strange time because on one hand, there is all this uncertainty around your own business. And we also had seen, or the whole industry had seen sort of 60, 70, 80% drops in revenue, and in walk-ins and in patient volumes. So there was all this worry around as a business person, as a head, as a leader. How do you keep your company afloat? How do you make sure you're not cutting salaries? These are healthcare workers, so you want to keep them motivated. You want to keep them incentivized. And at the same time, how do you keep your cash flows in check? And at the same time, we had, nationally, Ministry of Health and Niti Aayog and ICMR pushing us to actually expand capacity for testing, because the estimation was that there were going to be large capacities. Of course, when we were keen to get demand forecasting, unfortunately, we were not able to get them. But at the same time, we found many states actually trying to stop us from testing. So it was a very interesting conflict in a lot of cases between center and state. And a lot of us as diagnostic service providers, every time we would try to increase capacity, we would face lots of roadblocks in different states that we were present in. So I think balancing, all of these different parts of the mix, your health and safety of your employees, the emotional motivation of them to keep working, even though they're not getting paid anything more than the normal compensation, but this being their purpose. The center, the state's agenda has been a really challenging and a very interesting time, I think, for all of us. In the business. In our industry, actually, for this PCR test, ramping up capacity is not a job of a few weeks, it's a job of a few months. It's a highly manual test, and you need to bring all the ingredients, chemicals, and equipments internationally imported. They're not indigenous in nature at all. And therefore, planning ahead of time and planning capacity build-up is actually a very critical part of it, which unfortunately, we did not see public and private sector work very well together to be able to get that kind of planning done in advance, because as we know, private healthcare has not really been regulated at all. And suddenly we were all pushed into this craziness where we were being governed by every municipal corporation in the country, who may or may not have obviously the same understanding about healthcare and diagnostics. So I think we've overcome the logistics, the operational challenges. I think the current challenges continue to be capacity. We still don't know where we are going, so we don't know how to build in advance. So everybody is building more incrementally. The second challenge, of course, continues to be sample movement and people movement all across the country. That's still a big challenge as of today. I think if we could find a way to resolve these two, I hope that we would be able to test many more people in India. As we know, COVID isn't going anywhere. It's only a question of how fast we can diagnose as many people as possible so they can get to treatment.
Where is the real constraint in capacity, if I may ask? Is it your test kits, or is it really talent and people? Given that it's a difficult test,
it's totally people. Because so it's a combination. The testing platforms, you can have automated machines, but you also need automated extractions. You need kits, and you need people, and you need space. These are all the things which are required. Now, usually diagnostics don't tend to have the large spaces like hospitals do. Our largest lab would be 40,000 square feet, but it's already, chock-a-block. So to be able to rent space quickly, to buy the instruments, to get them imported, have extraction systems, and then have trained manpower. Because this particular test, pre-COVID, just to give you an example, we were doing, let's say, HIV, hepatitis, dengue, these kind of PCR tests before. The best chain of labs, like one of the top 3 leaders in the country, including us, would be doing a few hundreds a day. So the numbers we were doing were very small compared to what is required today. So therefore, you don't have that ready capacity to go, and you need to build it.
Yeah, got it. Anish, if I may come to you, your company, Healthium, I know has a strong presence in smaller cities. I was wondering if you could give a perspective of what some of the differences are that you've seen in large cities compared to, and metropolitan areas where we're all familiar with, and some of the smaller cities.
Yeah, so Bart, while the industry estimates indicate that there's a deferment of elective surgeries and the reduction in footfalls in the OPD, as Dr. Raghuvanshi also alluded, is to the range of 50 to 60%. The impact from what we see is higher in the larger hospitals. Even our coverage of approximately 18,000 hospitals covering 500 districts, what we are seeing is a faster recovery, especially in the small and mid-sized hospitals, where recoveries and footfalls have increased in the last month or so by about 30 to 40%. And in tier 2 and tier 3 cities, footfalls are returning to almost pre-COVID levels as we speak. Now, of course, one of the segments that has been completely unaffected is the OB-GYN segment because of childbirth, and I'm speaking more specifically to the surgery segment out here. But clearly what we are seeing is that, as opposed to the larger cities and urban centers, the smaller areas, the tier 2, tier 3s are coming back much faster. In fact, we've seen a sudden uptake in the last 1 month as far as tier 4 is concerned. The volumes have almost doubled from April to May. And the other thing is that, on the implant side, the things are still very slow. They're about 20 to 30% of pre-COVID levels. But on the consumable side, the demand has really gone through the roof. So for example, we are manufacturers of gloves, and the demand of gloves has more than doubled, which I think is the norm that is following the PPE increase in PPE that has happened over a period of time.
Yeah, which I guess is also partly triggered by just requirement for COVID treatments and the like.
It cannot be sustainable unless there is a big shift in the usage patterns.
Yeah. Good. Raja, if I may come to you next, Sanofi has a pretty broad product portfolio all the way from vaccines to analgesics to insulins. What are some of the big shifts and changes that you have witnessed on the pharma side?
So I think, Bart, for us, it has been, I think, really two parts. There is the industry initially spent, all the work on trying to make sure some of the supplies keep going. And I think, so to that extent, I think there was a frenzy around making sure that, people are getting, factories are working and supplies are coming. So the demand side is something that is becoming visible only now. The first 45 days really have gone around making sure that, factories are working and supplies were there. But what are we seeing? We're seeing two big changes. One, there is a part of demand which has got advanced, which is really around, chronic diseases, around diabetes, around cardiovascular, etc. So we're seeing a big upstocking which has happened over there, both at the retail level as well as at the channel level and at patient level. The second is demand which has got lost, which is really around, when you're talking of linkages to elective surgery, postponement of, to some extent, vaccinations which have taken place. So I think what the industry is seeing is a mix of these two. So depending on how your portfolio is, you've really performed. So if you have a much, much stronger presence in chronic medicines, you tend to do better. If you are far more sort of present in acute care, you've lost out in this, for demand at this point of time. But what we do see very clearly is that there is very, very active engagement with physicians now coming back, even though it is happening on a remote basis more and more. And I think the pharma sector in totality, if we were to say that, it's hit by about 10 to 15% versus what was, what I would say, pre-lockdown levels, that is something that we should expect will continue for another few months, in the industry. And what we aren't yet seeing is the impact of new patients who haven't really come to OPDs for the last, 2-3 months, and particularly on in the therapies and recruiting new patients. That impact is likely to come a little bit later. So it's really, it's a mix of, different things across different therapies at this point of time as well. But surprisingly, we saw strange things like, vaccinations getting postponed even for pediatrics, which surprised us. But, it's quite understandable because, parents weren't so comfortable coming into, into clinics for doing that. We saw people postponing knee surgeries. And so a lot of demand postponement has also happened proactively by patients. And it's not just about availability at a hospital.
I see.
Yeah.
One follow-up question. You operate a pretty large sales force, right? That visits doctors, on an ongoing basis. What changes did you have to make at your organization in the last few months, given that I would imagine many of these people would not have, had an opportunity to access, physician chambers? And which of these changes do you expect to continue post-COVID?
So I think we went on, we stopped going to clinics and visiting any hospitals on the 17th of March, just a little ahead of the lockdown. And, that's a decision you take immediately. And I think over the last, 3 months, we've been investing in two areas. One is, of course, training people to engage with physicians and with hospitals, remotely. So what have we been doing? We've largely been actually upskilling people, getting them, comfortable with digital tools, making sure they are, handling, any of these conversations, responsibly, because physicians are also very, very busy. I think the one thing you can't afford to do at this point of time is generally go around, engaging with people when the demands on the time on physicians is very different. So a large effort is around getting most of our field force comfortable with technology and then being able to engage. And parallelly, a big engine working around preparing content which is now appropriate for digital engagement, etc. Yeah. I think the second thing I feel we have done a lot, which we've learned to empower far more at the field level. I think today one of the things we've got to learn is to stop running a lot of these things centrally. And we find that, people are far, far more capable if they are empowered to take, a lot more decisions. Traditionally, pharma tends to run like an army. But I think today, if you can really trust a lot of your talent to be able to manage a lot of these engagements on its own. So for us, two big things, technology and empowerment, I would say, are the big changes we are seeing in the last 3 months.
That's an interesting observation.
Yeah.
Coming to Pavan, your organization supplies products to hospitals and to path labs. What are some of the most important changes that you've made internally to manage through this crisis?
Hey, thanks, Bart. One thing definitely that has impacted us is that over the last 3 months, first we went under. We weren't sure how long we will stay under. And as we surfaced, we breathed a sigh of relief that the recovery is there. But now we look around and it is a big ocean, so the land is far away. So what we are seeing is definitely there is an upshot for if you were to do anything to do with diagnostics, especially in the COVID diagnostics, or if you're in non-COVID diagnostics, then you're seeing a little bit of a wash. There is a focus on COVID diagnostics. Most of our technologies were not probably ready in India, and therefore now we are on a supply situation where the developed world is taking most of that. So we don't have those products available in India. So there it's like you're sitting on the sidelines and watching the fight evolve. But non-COVID diagnostics is seeing a slow pickup and recovery as the patients come back to the hospitals and the OPDs are coming back. Interesting observation that we have is that the large referral labs are picking up patients faster for testing than the tertiary care and acute care facilities. So that's something that we are watching, that the reference labs seems to be at the cutting edge, as opposed to what Anish was talking about, how care is going to tier 2, tier 3 markets. So that's one that we are seeing. There's also a portion of our portfolio which is non-acute care facing labs, or this we play in research segment, we play in chronic diabetes care, and we are partners with pharma companies for their injectable drugs. There we did not see much of a change. The COVID impact was limited to the logistics impact that we had in the first 15, 20 days when nobody knew what they were doing. So that's when we had actually a shutdown. But for, say, a significant portion of our business, that's not a headwind. That's like a calm sea, and we're able to maneuver. But acute care facing businesses, that's a strong headwind. What we are doing is to ensure that we've established certain leading indicator sensors, for example, OPD occupancy, footfalls, tier 1, tier 2 reference labs. We're watching for those leading indicators and pivoting the organization's needs, managing the inventory, ensuring that what are critical products, the supply chain is continuous, work with our global organizations to feed us where it is needed. While doing all that, keep the sales force ready so that when the lock is open, they're at the right place to serve the patient. And that's pretty much sums up how we have been pivoting in this difficult time.
Interesting. Thank you. Dr. Raghuvanshi, let me come back to you and sort of take a bit more of a forward-looking perspective. I was keen to hear your perspective on what some of the things are that, as organizations, and perhaps even, as a nation, that we need to do to reboot healthcare again and get patients to seek just normal levels of treatment again. You mentioned already the point around, building confidence that the environment is safe, but are there other things that you see that, organizations can or should do?
Yeah. No, there is definitely going to be a change in behavior or how people access healthcare. And I think one of the points which Anish made earlier, I agree with that you see the secondary markets, the patients they're serving, the smaller hospitals in secondary towns and smaller places, those clients will remain intact. And that's probably the reason why the larger organized players are seeing a much larger dip and the recovery is much slower compared to the smaller players, because within India also patients move from one place to the other. So I think as hospitals, as organizations, the larger players will have to have a different approach towards outreach to patients. And I think technology and digital is going to play a very, very important role. Now, telemedicine always existed, but it wasn't really a significant part of the business for any of the providers. I think those things are going to become integral part of how we, conduct our patient care. And that is, I think, going to be a very, very visible change, and it will be here to stay.
Interesting. Are there any initiatives that you've taken already internally in your organization to, to digitally enable, this kind of reach out and contact with patients?
Yeah, so we already had a kind of a plan which was sort of, in motion. However, it wasn't taken as seriously as now everybody is taking it. So we had to sort of make some kind of makeshift arrangements for teleconsultation, for instance. Though we always understood its importance, but we never really put a framework in place. And we thought that it may be better to create a larger digital ecosystem rather than just going for one quick fix. But this sort of brought it into focus. And we do have a kind of a digital framework on which we are working. I think we cannot just simply do just one or two initiatives. We'll have to create that entire ecosystem. I think one more thing which has emerged very importantly here is the value of collaboration with other organizations. One organization will be able to provide solutions because patient doesn't need a kind of an episodic solution. Patient needs an entire continuum of care. So I think it has become very, very important now to work with other organizations. We can't work in isolation.
Yeah. Yeah. Let me come back to you, Ameera, if I may. So from your vantage point, what do you think needs to happen to get your patients in front of doctors again and get back to normal or quasi-normal levels of non-COVID diagnostics?
So we've actually seen something very interesting because, all the consulting firms and consumer research firms who presented to us their data of how they think healthcare is going to change. We are actually seeing the opposite of that in practice. So, there's a lot of theory that people will want to move to telemedicine. People will want at-home services. People will want drive-through testing. But we're not seeing that on the ground so far. On the ground, we're still seeing people preferring brick and mortar when it comes to diagnostics. And that hasn't changed significantly from before. I do believe that home services will increase to some percentage, but is it going to drastically transform the industry? I don't believe so. because the people are still comfortable, while there might be a fear of going to larger institutions where people are worried about potentially getting a COVID infection. In diagnostics, obviously, people are not afraid of coming into a lab where anyway you get, in our fragmented network, we get few patients a day per center. So it's not that you're having hundreds of patients sitting in one center, and therefore people are not fearful of coming to labs, I think. So therefore that I believe will continue. And a few percentage of us will continue to want to do home services. So that's one consumer change that will happen. The second is that, today 85 to 90% of the industry in pathology continues to be controlled by the unorganized market, which is all the small labs, most of which, 90% of which are run by technicians and only 10% are run by pathologists. I think this was the case because patients never really thought about safety, hygiene, quality in a pathology laboratory because they use it once a year. So they thought, oh, how different can it be? A cholesterol is a cholesterol. I'll go to any lab. It doesn't matter. That was the mindset. And I believe that this entire crisis will at least now bring to the forefront, what is quality lab, who has the ability to do advanced tests and not, and health and safety and hygiene will become very, very critical part of the customer experience. I think this is where we will see some movement of business from unorganized sector to the more organized branded chains like ours. And I think that change will happen in the next few years as we go along. The third change that I believe will happen is because of these consumer behavior changes, we will see more consolidation in the industry. A lot of people have always believed that pathology is easy to run. So we've seen a lot of corporates, hospital chains, lots of people come in, put capital and start thinking, if we can run X, Y, Z, why can't we run pathology? And I think what's happened in the last 7-8 years, we've had lots of companies come in, but all face losses. And they continue to sustain losses. So I think there'll be a lot of consolidation that I believe will happen from here out.
Interesting. That's an interesting perspective. Pavan, if I can come back to you, your company is a large multinational operating across many markets. Many of these markets have been affected earlier and have come out of lockdown earlier. Yeah. Are there a few learnings that you have picked up from within your international network that can be valuable for businesses and organizations here in India?
Definitely, Bart. I think the first big learning we are having from China, which is actually ahead of a lot of them in terms of recovery, was that the customer or the patient did not go back to the class 1 hospitals. They were going into class 2 and class 3 hospitals or the smaller hospitals. They were not wanting to risk travel as well as a large scale facility where there were, I think, fears of infection. And what Anish says actually is something that is playing out in India. And we expect that we need to be prepared for that, which is a lot of the large tertiary care facilities in metro actually get footfalls from other places. Yeah. And if the travel is going to take time and the recovery in airlines, in medical travel, or smaller mofussil towns going there, we're going to see more care happening in tier 2, tier 3 cities. And therefore, that's one pivot everyone needs to do to see where that is happening. That's one that we have learning from China. Another learning we are seeing wherever the recovery has happened is if you were expecting the recovery to go back to, say, February in India, which is indexed at 100, it wasn't happening. Including our China learning is that the recovery is actually not going back to 100. It is probably in 75, 80, and probably it will take another 3 to 6 months for people to come back to using those services. If these are two learnings on the demand side and how we need to, we're obviously learning lessons on cash conservation. That's a mantra everywhere, both from expenses side as well as how you manage your working capital, all forms. That's a learning that we are having. How do you keep your team together? Worst time to have attrition when a market is going to recover and you're going to struggle to actually put a ready sales force back in place, which will delay, say, another 6 months. So you want to be there when the water is rising. You want to be the first boat along with that water. So we are working on ensuring that we keep the organization together, the team equipped and ready to go when that happens. So these are some of the learnings that we are seeing as stabilizers. One big probably opportunity segments that we are seeing is that COVID diagnostics is becoming like how developed world calls flu. Every year you have a flu, which can either be a tailwind or a headwind, depending on, how it plays out. So that's a large, Wall Street watches how your company is impacted by flu. We believe that there is going to be a COVID segment that will come up. And we are also seeing care moving outside of acute care facility. So how do IDN kind of structures that are there where a same facility owns a smaller primary care center or diagnostic lab, how do they keep the patient within their network is something that we see as that will probably happen in India.
Yeah, interesting. Dr. Raghuvanshi, I'm keen to hear your perspective on the point that that Pavan was mentioning around patients perhaps moving more towards tier 2, tier 3 cities to get treated rather than traveling towards large tertiary care units in larger cities. Is that something that you're seeing? And if so, how as an organization do you expect to respond to this?
Yeah, I agree with that. That is only natural. If people cannot travel comfortably, then that is bound to happen. And typically the metropolitan larger players were dependent on medical tourism sector, which was about 10% of the revenue. And then a lot of revenue came from the hinterland, not necessarily just the local communities. And that, I think, is an important change which is going to happen. But I do agree with what Ameera was saying is that, the behavior doesn't change so dramatically suddenly. So it will take some time. I think what the organizations will have to do, the tertiary care organizations, acute care hospitals, will have to focus a little more on procedures and complex work rather than trying to provide very basic kind of care, because that is likely to happen in other settings, as Pavan said. It could be smaller clinics, etc., or at least it could be home setting, or it could be any other setting. But that the acute care setting definitely will not be used by patients for simple illnesses and say diagnostic, etc. So I think that is going to be a little bit of change, and I think the tertiary care hospitals will have to focus more on procedures, etc., and try not to depend too much on the basic services.
Yeah. Would you say the talent in those places actually exists to be able for those institutions to make that shift?
No, I think that problem is not only for those places, but it is for the entire country. I think it is not only a challenge of human resources, but I think it's also the business models become complicated. Just the fact that there is a need for service in those places doesn't necessarily make a very viable kind of a business model. And many private hospital chains who have opened hospitals in secondary and tertiary towns have learned it the hard way, because the paying capacity of the patients is lower. And at the same time, to get the talented clinical manpower, you have to pay more. So you're sort of widening the gap, and profitability becomes more and more elusive in those areas. So I think that is where the public health will become an important part in a country like India. Unfortunately, whatever economic situation people are in, they are in. And they need services. So that can only be bridged if the public sector fills in that space. But whatever is done, whether it's public sector or private sector, I think the human resources issue in healthcare, if that is not addressed actively at the same time, I don't think any solution would work.
Yeah, that's a good point. We've heard a few people mention, during the conversation today, how technology, digital, new business models will be important to think about going forward. Raja, maybe I wanted to get your perspective first. Have you seen any interesting innovations either on the technology side or on the business model side where you think this is something that is likely here to stay?
There are a lot of obviously sudden spurt of initiatives and pilots all over the place. I think the one area which I see is that video as a format is something that is going to be central to everything that changes. And I think we are all not well designed, in terms of managing the opportunities which video as a format gives us. Now, whether it is on engagement, whether it is on, communication, whatever it is, but I think, our technologies are, not well designed right now in all our organizations to support video as a format. And that's where the biggest opportunity, I think, lies for all of us. The second piece, which seems to be, coming through, is really on how do you use analytics. Am I seeing something new at this point of time? Nothing which is very dramatic in what is available right now, off the shelf. But there are a lot of attempts and there are a lot of new initiatives. If there's one thing we are learning is that, we all run the risk of overestimating the impact of change now, but we will also equally underestimate it for the future. So how do you sort of, parallelly keep yourself active in all the technologies? So my sense is that the one thing we've got to learn to do today is to be participating in everything that is around. It is going to be a mess for a while. There's going to be many engagement platforms, many doctor consultation platforms, lots of e-pharmacy recommendation portals, everyone trying to do e-health, trying to be neat about finding out which one is good for us, which one is not, I think is a long haul. So yeah, one of the things that all of us people must do is that you just need to keep connecting, and participate in different places. And hopefully there will be a aggregation which will take place and a few people will come through very strong. And I think that's, the one, because otherwise it can be a distraction to just, try and figure out, build your own stuff. Because I think in healthcare, particularly the six of us who are over here, I think none of us is going to be the technology breakthrough person. I think the aggregation it will come from outside the medical industry. It won't come from within the medical industry. It will come from people who understand data, people who understand connectivity, people who understand formats, and one of those will come and aggregate many of us together. But till then, we just have to participate and be there so that we don't miss out. And like Pavan was saying, you got to be on the boat when the water is rising. And that's, I think, what is happening in China. People are just, the aggregation in technology is not happening by any of the medical guys. It is happening by people who are coming from outside. And I think, I would say, we have to be alert to what is going to come from there and just plug in. And like Dr. Raghuvanshi said, it's going to be an ecosystem issue, and you got to be there. Everyone's going to fight for who owns the customer or who owns the patient. And I think that's where the eventual battle is going to be on in technology.
Interesting. Ameera, if I may come, to you next for a perspective. You mentioned earlier in our conversation that, contrary to some predictions, you still see a lot of patient flow coming to diagnostic labs. But if you sort of reflect on the question, business model innovation, technology, have you seen interesting, new developments over the last couple of months that you believe, will have longer term potential?
I have not seen anything specifically in diagnostics that I believe will drastically, like I said, transform the industry. I think there are a few early trends which we may start seeing, as I mentioned earlier, the at-home services. However, back to the earlier point being made by Raja, I think the question is really going to come back to, like he said, as to who really owns the customer. And I think this is where we are finding a lot of organizations. Everybody's now trying to build the same e-health platform. Yeah. Everybody wants to do telemedicine, treatment, diagnostics, and pharmacy all rolled into one. And I think what's going to land up happening is that rather than each person doing what they're best at, we're all going to land up becoming me-too players who have got sort of a similar commoditized platform available, and it's frankly nothing is going to be really differentiated for the customer. Back to Dr. Raghuvanshi's point, I think we have to find a way to collaborate rather than everybody trying to do it on our own and feeling like, oh, we now have the patient. I think the real success is going to come from who is able to analyze the data and who's able to add value to the patient's life. So I think that's the direction we must go in. I think it's easier said than done, because I think most people will act out of insecurity of not wanting to lose the patient and lose the patient's data. And I hope that there are enough thought leaders, in the industry where we can collaborate.
Just a quick follow-up on that. I fully agree with you. Do you see any natural, industry participants who can play this more, I wouldn't call it aggregator role, right? But, bring everybody under the fold, think about, holistic patient experience, have a much more integrated approach. Who will lead the way there? What's your perspective on that?
I think my sense is actually pharma, I think, actually can lead the way there. And the reason I say that is because they are usually in the entire healthcare ecosystem, pharmaceutical companies are actually the largest. They have the maximum coverage of doctors. They have the maximum field forces across the country. And they touch maximum consumers' lives. Whether you talk about hospitals or service providers or diagnostics, we touch far fewer consumers than pharmaceuticals do. So I believe from that perspective and from a scale perspective, I do believe that they can be probably the middleware that connects many of the healthcare stakeholders in this ecosystem.
Interesting. Raja, would you agree with that?
Yes, I think logically it would be, and it would, of course, like I said, it would need pharma companies to step out and go for agnostic platforms, because the minute you start, because unlike many other industries, pharma is extremely fragmented. So you need to have the ability to be agnostic, and it doesn't matter whether it is your pharma product line or the rest of the pharma product line. You're looking more from the patient point of view, disease point of view, and you're aggregating. I think they have a very strong role, and that's I think very important, because pharma companies also tend to be global. So the scale is also much more easier for us to be able to implement across. So I would hope that we will get the support for that and do that. Yeah.
Excellent. Let me perhaps shift to the topic of, we're fortunate to have you all here. And it's typically, during periods of crisis that you really get tested as a leader. If I may come to you first, Pavan, what did you find most challenging in those, personally challenging in those last couple of months? And are there, any lessons that you would draw for yourself in, what to do differently going forward?
But I would say the first 10 days was the challenge. That was when we had completely, a deer in the headlights phenomena. Nothing worked in the ecosystem. The government had its own problems of federal versus state and how they talk to each other and what gets done. You couldn't get out of your condos, or you couldn't get out of your house. Your domestic health disappeared, and you had a business to run. So it's a 360 challenge that I faced in terms of, probably it has been time when I did household work like cleaning, kitchen, dishes. So I had to learn that and still manage my employees and, whether supply chain works, what permissions are needed. So the challenges we faced were more if you were to have been dropped 500 years back in society, which is like, can I get to talk to government? Who in the government? Central government said you could supply essential services, but the policemen in Bangalore were beating up our delivery people and our supply chain partners. So how do you resolve that? So that was the first kind of crisis that we had. And then how do you work within the family with 6 devices that needed to work because everybody was working from home? Gradually, as ecosystem settled in, the next fear that we had to manage, and I managed, was how do I communicate with management on the impact and how long this impact will last? Do I take actions to conserve some of the resources, or do I hold off? Fortunate there that the entire world was sinking at the same time, so I didn't need to fight India battle. It was a together battle, so there was a little bit of relief for about 40, 45 days. Now, actually, it is about pivoting, and the challenges that I face are, where do I bet? Ameera was saying, her learning of theory is saying home care will go up. do I actually start putting together a case for home care, and what do I do differently for home care versus what do I do with Salesforce, physical versus digital? Those are the challenges that I'm facing. And at a personal level, with all facilities shutting down, exercise is a constant difficulty, and therefore, your passion, where do you divert and hold off till you get, I can't play, so okay, when do I get time to exercise? So those are some of the challenges, professional and personal, that I had experienced and what I'm looking at.
Excellent.
Thanks for asking.
Anish, if I can, the same question to you. What are some of the challenges that you faced as a leader, and what are some of the learnings that you would draw out of this experience?
Yeah, so Bart, I think probably we were lucky to be in an industry that was classified as essential services.
Yeah.
Unlike a lot of industries and companies that were completely forced to shut down for more than 30 days. For us, it was about keeping all our plants running and ensuring that we have the management, local management at the plants, as well as the labor coming up and showing up, and ensuring that production doesn't go for a toss, right? And that was sort of an initial phase where there was a resistance from a lot of plant managers also. But then what we saw is, over a period of time, people really, came out as leaders, and you had a lot of instances that really, where people stepped up in taking on higher responsibilities. So we had plant workers reassuring villagers that they feel safer at a plant as opposed to the village itself. We had sales teams traveling 300 kilometers to bring stock required for emergency surgeries. We had plant managers emerging as a leader to deal with local police and government authorities. Supply chain was in a big disarray. At least for the first 15, 20 days, we had no movement of stocks happening, and the stock was stuck all across the different parts of the country. But I think what was also important is how we use this opportunity. And, one of the things that we had realized earlier is crises like this, cash is, so we really need to manage your cash flows better than what you have in the past. And I think things like, while we did take precautions like social distancing, thermal checking, and, the usual providing of mask, gloves, etc., what was very important was to manage the mental health and anxiety of the people and their families also, right? Because the families were also very concerned about the people coming to the plant or reporting back to work. So, counseling for families, no salary cuts, incentive for workers, undertaking all these really helped us to sort of keep their confidence at bay and make them focus on work. I think compassion, transparency, empathy will become very pivotal roles as we move forward now. And how do you manage the mental well-being, offer family-friendly, flexi ways of working, combat COVID-related stigma, because we have our entire field force out there. We've got almost 300 people who've been going to the market for about a month now and working very closely with the surgeons in the hospitals, right? How do you make sure that the social stigma and discrimination doesn't happen with some of these folks who are spending a lot of time out there in the marketplace? Becomes very, very important. How do you keep on upskilling the team members to the new realities? And that will be a key factor in terms of fostering healthy key relationships. From a business perspective, I think cost and cash consciousness across the organization, tracking of KPIs under the new normal, health and safety and constant innovation are the key areas that we're looking at in terms of further movements as we sort of get past the lockdown stage.
Excellent, thank you. And that's perhaps a good segue for me to pick up a question from some of our audience members. This is primarily, I think, directed to Dr. Raghuvanshi and to Ameera. So let me ask each of them to react to that first. The question is how companies are supporting their own employee community, particularly those who are sort of in the frontline staff in hospitals and in labs. Ameera, if I may hear your perspective first, and then perhaps Dr. Raghuvanshi.
Sure. So I think the first thing was obviously just to make sure of safety, right? So whatever we needed to do from a perspective of outfitting our people who are going and visiting patients at home, or who are working in the lab, or who are on the sales force on the field, logistics boys, etc., to make sure that they had all the safety gear to combat this. The second was to give them the peace of mind that even if after having the safety gear, if something happened to them, we would make sure that we had insurance and we paid for their hospitalization, We took care of their family members, etc. Of course, if there was a death, which there wasn't, then there would be also a life insurance and other things that we would take care of. Along the way, we also had to provide comfort, logistical comforts of, making them come to our facilities in buses, that they were, COVID-free, making sure that we were putting them up in hotels wherever required so that they didn't have to commute and take the risk back to their families. And of course, lastly, making sure that financially they were protected by not cutting their salaries or laying off people or any of those things. And of course, fourth, a lot of communication to tell them that we were right with them. And while they are on the front line and some of us are not, we are doing other things and we're sharing the pain and the burden and the responsibility, and that we have their back. And I think these were some of the critical things that came out. Personally, for me, while I was, of course, dealing with government policy a lot, working with the government very closely, obviously being a managing director, which means management, but also an owner, which meant also dealing with shareholding issues that came up. A lot of them came up during these last 3 months. I also had a baby 3 months ago, right before Corona. So 9th of March, I delivered, and I was out of the hospital by 12th of March and on calls with the government. So it's been a very interesting 3 months.
I can imagine. Dr. Raghuvanshi, perhaps perspective from you, what has your organization done to make sure that frontline is feeling safe and secure?
Yeah, so right in the beginning, when we saw the pandemic coming, so even before the lockdown, etc., was announced, we had started looking at measures to see how we can protect our people, especially the frontline workers. So we took several steps, and we designed teams in a manner that that the continuity of service delivery is there. But I can share with you that during this phase, we have seen such inspiring stories from across our network. We've had a situation where a physician, a critical care specialist from the ICU bed, being suffering from the disease himself, is treating other patients and giving advice to the other clinicians. And there have been heroic tales of how far people have gone. But at the same time, I think as an organization, we had to protect their interests. So we did many of those measures, like what Ameera mentioned, in terms of logistic support, making arrangements in hotels, etc., for them to stay, and also taking care of additional insurances, both for life as well as for medical coverages, etc. But I think for hospitals especially, it is a double challenge. And one of them is the kind of morale, which is very low, especially because of the very negative narrative going on in the popular media. And I think that is something which is very, very demoralizing for the doctors, for the entire workforce in healthcare. And I think to tackle that, we have to do a lot of steps. So we have created an internal helpline, which sort of works 24/7, and we created many other supportive measures like that in order to make sure that people can work under the stress. And then tragedy hits pretty close for people in the delivery sector. It's like the soldiers being criticized in the middle of the war. So I think this is a very trying time for hospital staff, doctors, nurses, etc. We're supporting them in whatever way we can, and trying to sort of keep their spirits high.
Excellent. There was another question, and let me direct that to Anish and Raja. The question is, will pharma and healthcare marketing change completely post-COVID? Which I guess is reflecting on the, potential access restrictions with providers and doctors. Anish, perhaps your perspective first.
Yeah, so I think in contrast to the IT industry or some of the other industries where technology is a norm, healthcare is far more people-centric, and it involves a lot of face-to-face interaction with hospitals, surgeons, other HCPs on a daily basis. And with the dramatic change in the working environment and with physical presence in hospitals becoming more and more difficult, we definitely have to keep on looking at different ways of interacting, of taking our products to the hospitals and to the medical community. And that requires us to adapt, technology significantly. So, while a lot of digital platforms have been used, digital CMEs have been managed, the thing is that, how are we equipping our own people to manage this transition, right? Because they have always been used to a certain style of work, and the sort of technology has been dumped upon them of late, right? So the collaborative use of work tools, and how do you make sure that people connect more vigorously in terms of managing some of these customers and connecting with them virtually? How do you make sure that you upskill your teams to stay relevant with any technical skills and soft skills that are required to go through this new norm? Training and counseling on various subjects which are beyond just their day-to-day operational areas. For example, what I mentioned earlier was on the anxiety, the social stigma. While a lot of it will be virtually, we still will have people contact. Folks are going to the hospitals, and we'll see more of them going out there. And at the same time, how do you make sure that you put existing workplace policies that also makes their family members comfortable, right? Because the families are also very anxious with these people going on. So, while we are adapting a lot of technology, we are fairly nascent, and currently the usage is primarily of digital tools or digital CMEs. But with the larger number of digital CMEs happening, I think there's a fatigue factor that is also coming in, right? So, for us, the physical contact becomes very important in terms of taking products to the hospital.
Yeah. Raja, your perspective on this?
Yeah, I agree with I think one part, the engagement will move to a far more hybrid model, which will be between, face-to-face. I don't think it's about either or anymore. I think it was acceptable not to be digitally connected earlier. I think that piece will move, and it will become almost certainly a hybrid model. What's the ratio will really depend as the situation evolves and the therapies. I think what will change also is that the support to physicians and hospitals on the patient side will become more active now. I think physicians will also need support on patients through patient support programs, on making sure there is the follow-up is there. And I think pharma companies will begin to support in that area. I think the third thing which will change in the area of marketing is that traditionally pharma companies have done marketing themselves, and there has been hardly anyone else in the ecosystem involved. And I think the future is going to be where you're going to create relationships with physicians and with patients more by engaging with the rest of the players in the system, and you can't do everything yourself. I think and for that there has to be an orientation shift in mindset and being able to let go and being able to work with partnerships, because traditionally most partnerships are only at the early end of development of product and rarely at the delivery end. So I expect a lot of that change to begin to come through.
Yeah. There was a question also on, if the healthcare industry is going to move towards reducing the dependence on imported products and using products more locally. Perhaps, a question for you, Pavan, is that a trend that you think will materialize over as an outcome of this experience?
Not sure, Bart. Short answer. I don't think any country in the world, if you look at experiences, have 100% reliance, or even if I say 70% reliance on products made in that country. If you say fountainhead of all medical device innovation is US, even US does not consume devices that % of it are made in US. And the other example that we can see is the emerging market, biggie China. Even China, 70% of the devices probably are imported, because the nature of the innovation and the manufacturing ecosystem is clustered around certain clusters across. And you can do it well only if you get global scale, which means you can have the stock of local for vocal and Atmanirbhar, but basically they are missing out basic design of how you can bring manufacturing into India for these medical devices. There's only two reasons why it should happen. Either India is the most attractive market and the consumptions will be there, everyone will invest, or it's the best cost destination that you can make an export to various locations. Since as a country, we have not got our act right on both of those, 65% of out-of-pocket payment, which means you can never value an innovation. And there's no fiscal incentives competing with other Asian countries, which means you can't get your cost attractive. Therefore, Made in India is a great conversation to start with, unless you follow it up with a lot of these changes and then stop assuming that healthcare private sector play is profiteering and a sin. If you don't tackle with all these three, you're going to say, you do the innovation, you make it in India, but I'll pay you peanuts. You pay peanuts, you get monkeys. You don't get medical devices.
It's a very clear perspective. Thank you very much. I see that we're, I think, at 1:15. Shiv, are there some questions that you've picked up that we wanted to still direct to the panel?
No, I think, Bart, you're covering most of them. I'm just trying to think through anything specific. Maybe for Rajaram, there's a question around R&D. I mean, do you see increased focus on turbocharging R&D for pharma companies, especially through investments in things like AI and ML?
Yeah, I think globally, this is going to be something which is going to get accelerated tremendously. I mean, I think this entire pandemic has brought together for the first time, over 140 companies together simultaneously in 3 months, and we've never seen that happen ever. I think so that is itself a big transformation, I think, for the global healthcare industry, because the ability to put together resources, deals have been, two competitors have partnered in 1 week to, develop vaccines together. I think we're going to see a big turbocharging as far as, putting people's mind together. The second, I think it's also shown the importance of, having very robust, data on epidemiology across, which is going to form the background for, further work on AI, etc. Because everything today, can be done with far more speed if we indeed had a much more integrated health record system, epidemiological data, things like that. So I believe that these are going to be two areas. If there's one thing I think I'm very confident and happy and optimistic is that the power of minds across the world comes together much faster, and that's something which will happen for the future.
Sure. There's another question which perhaps for Dr. Raghuvanshi around the future view of rural and government healthcare, which is in, obviously in shambles and been exposed quite badly. Just, do you see any major changes after this?
Yeah, no, as I said earlier that, the solutions cannot be provided by private sector at the kind of, at the bottom of the delivery system. I think the public healthcare has to take care of those. But I think the biggest problem there is not of physical infrastructure, but people. And I think unless the human resource issue is addressed comprehensively, this problem will remain. But I think government will be more focused now on delivering that last mile. And I think that's how it should be as well. So I think if there is a more focus on that segment, and also things like, empowering the nurses to be practitioners at primary care level, etc., could partly address the human resources issues.
Sure. Bart, if you picked up any more questions, you.
Well, there was a question around, there were a few questions in that, around the same topic, which is around India being largely an out-of-pocket market. And at the same time now, there's, following this health crisis also, there's quite a deep economic crisis that has hit as well. What's the role of private and public payers in healthcare going forward? And will we see a shift change over the next couple of years? Let me perhaps ask Pavan for a perspective, and then Ameera.
That's a hard one to predict. I think definitely there is going to be a slow action plan to increase healthcare access and probably get Ayushman Bharat right. It's a great scheme, but they haven't got the key supply side fixed in terms of having wider participation from private healthcare. As they get that right, I think there would definitely be more increased access and possibly they'll be in a better place to serve these patients. This was a great opportunity to actually boost up public infrastructure and the public side of healthcare. And I hope that the governments across both federal and the state would take a look at and invest for a COVID repeat, the further pandemics that will come, and the self-reliance angle that they've got, that we cannot let this be dictated by, say, uncontrolled forces. So I'm hoping if they do that, it benefits the patient. Whether a multinational company or a private sector benefit or not is a secondary. If the patient benefits, they will go to the best possible healthcare, and then we can all compete for delivering that best care. So that's where I see. I may not have answered exactly whether private will prosper or a public will prosper, but that's where I see.
Yeah. Ameera, what's your perspective on that question?
Sure. See, I think, I think health has become, unfortunately, a very political subject in India. And I think till the time we deal with it as a political subject, I think there is little progress that we can make in terms of finding the right solution for how healthcare should proceed. Most other countries across the world are not providers of healthcare. They are buyers of healthcare, purchasers of healthcare. And the Indian government for 1.3 billion people must go in the same direction. Because for them to provide, for anybody to provide, good healthcare to 1.3 billion people is too much of an ask. I really hope from this crisis that they do move more in the direction of public-private partnerships, and I do hope that mindset of saying that private must not profit here, and therefore we must bring down the prices as much as possible so that all voters feel that we have done right by voters. I think that mindset is not going to take us anywhere. The reality is it costs a certain amount to do a good quality test. It costs a certain amount to treat a patient, and if we don't recognize that, and if we're not willing to pay for it, there's going to be a challenge. So I think it has to move in the direction of, insurance funded by government and insurance funded by out-of-pocket. I don't think there is any other way. This out-of-pocket model is completely unsustainable. I only wish in the stimulus package, we had heard that, we are allocating 50,000 crores to fight COVID. And then we are allocating another, 3% of GDP to build public infrastructure. I think that would give confidence to the Indian society that the next time a pandemic comes about, we should be hopefully ready.
Bart, if I can just add to that.
Yes.
In our neighborhood itself, there are various models that have been working very well over a period of time. So, you have universal healthcare in something like Thailand, which has been very successful. And, the main essence of the universal healthcare is also they're using it to draw foreign investments into the country. Now, to Pavan's point, why should I invest in a country where I don't have a captive consumption? By working very closely with the large companies, countries like Thailand have been able to get significant amount of foreign investment. And the other countries, Indonesia, which went through a very different model, where the universal healthcare didn't work earlier, but is working now. And again, the push is for local manufacturing. Now, if there is captive consumption, large players will come and invest in any market. But without that, there is really no motivation. And the other model is like that of Singapore, where Singapore as a country says, we'll tax you only at between 15 to 20%. You take care of your own health. Yes, we do have a couple of schemes that you can subscribe to. Over a period of time, you collect money within that schemes, and then it pays back for your healthcare and medical needs. And I guess for us, the fact that health is a state subject makes any kind of implementation that much more difficult, right? So unless and until there are some central directives, we will continue toggling between the two.
Yeah. And I like the Indonesian example, I must say, because I think GDP per capita is an important starting point to. Singapore is in a very different place, of course, compared to India, but Indonesia is pretty much in the same sort of zone. Good.
But I think we're out of time. There's still a bunch of questions, but I think we're out of time. Just being conscious of everybody's thing. For all 6 of you, really big thank you. I think this was more than a fireside chat. I mean, I would call this a masterclass in healthcare, and I think it was great that we actually had a very diverse panel with all elements of the healthcare value chain, which I think really brought the conversation to life. So really on behalf of all of us, a big thank you, Ameera, Pavan, Dr. Raghuvanshi, Rajaram, Anish, and of course, Bart, for being a great moderator. Thank you, guys. Thank you. Take care.
Thank you. Thank you. Take care.
Thank you.